Okay, so for our assessment of the canine respiratory system, first what I'm going to do is observe the respiratory rate and effort of my patient and listen for any audible respiratory noise. Now before I get started with the respirator, I just want to point out this is his thorax on his right side, this is his abdomen on his right side, and now I'm going to auscultate for his respiratory rate. So I'm going to listen and count his respirations for 30 seconds. And the amount of respirations that I hear over the course of that 30 seconds, I will then multiply by 2 to obtain his respiratory rate per minute. And once I'm done getting his respiratory rate, I'm going to auscultate the lungs on both sides of his thorax, listening to all 4 quadrants on both sides. So I'm starting with his right side in the dorsal cranial quadrant. I'm going to be listening for inspiration and expiration sounds before moving on to the ventral cranial quadrant. Again, inspiration, expiration. Now his ventral caudal quadrant, inspiration, expiration. And now his dorsal caudal quadrant of his right thorax. Then I'm going to repeat this process on the animal's left side to listen to his left lung sounds. Again, listening to his quadrants, dorsal cranial, inspiration, expiration, ventral cranial, ventral caudal, and dorsal caudal. Again, listening for inspiration and expiration sounds. And that completes the assessment of the canine respiratory system.